Thanks for giving me an opportunity to share our research outcomes with ICS meeting attendees. Today, I will present our data showing that repeated low dose of acrolein triggers irreversible lamina propria edema in urinary bladder and transient voiding dysfunction. I have nothing to disclose. Cyclophosphamide, CYP, is an alkylating agent used for a wide range of benign and malignant disease. CYP treatments are known to trigger hemorrhagic cystitis in patients and animals. This can be explained by a known mechanism that acrolein, a metabolite of CYP, is stored in the urinary bladder during the storage phase, damaging urothelial components. In both clinical and biomedical research, a significant effort has been made to avoid CYP and acrolein-induced cystitis while still maintaining the benefits of using an alkylating agent for therapy. As a result, lower doses of CYP are currently given to targeted patients in clinic compared to past treatments. Given that the majority of previous studies aimed to understand the mechanism of CYP and acrolein-induced acute cystitis, little is known about the effects of repeated low-dose CYP and acrolein on the histopathology and physiology of urinary bladder. We hypothesized that repeated low dose of CYP does not induce voiding dysfunction, but triggers sustained histopathological change in urinary bladder. We aimed to establish a murine model recapitulating in vivo changes in urinary bladder among patients that receive a low dose of CYP. To establish a murine model, 3 doses of 10 microgram acrolein in 15 microliter were transurethral given to adult female C57 blastocyst mice on days 0, 7, and 14. As a substantial number of patients undergoing CYP treatment are known to undergo repeated periodic exposures, our murine model is designed with repeated treatment at intervals, which are known to be sufficient for reversal of a one-time dose of CYP and acrolein-induced voiding dysfunction. Briefly, mice in the acrolein group have a 7-day treatment interval in between the 3 doses of 10 microgram acrolein and 14 days of a treatment-free period between the last dose of acrolein treatment and tissue harvest. 15 microliter of PBS transurethral instillation was given to a control group. Body weight was measured and voiding behavior was determined by filter paper assay on day 1, 8, 15, and 13 post-instillation. Histopathology of urinary bladder harvested from day 1 and 30 post-instillation was determined by hematoxylin and eosin staining. Our results shows that body weights were not different between the PBS and acrolein group. Mice that had both 1 and 3 time transurethral instillation of 10 microgram acrolein showed lamina propria edema in urinary bladder on day 1 and 30 post-instillation. The first dose of 10 microgram acrolein did not trigger voiding dysfunction, but the second dose triggered transient voiding dysfunction with high volume, low frequency voiding. In contrast, 85 microgram of one-time acrolein instilled mice previously showed low volume, high frequency voiding, a typical pattern of voiding dysfunction in acute inflammation of lower urinary tract. This slide shows how the cutoff points for voiding frequency and voided volume were established based on the 90th, 75th, 5th, 25th, and 10th percentiles of mice studied. In conclusion, mice that received repeated low dose of 10 microgram acrolein do not show altered voiding behavior at day 30, while their urinary bladder maintained histopathological abnormality. Our study suggests that urinary symptoms among human subjects that have a prolonged low-dose exposure to CYP may differ from previously reported urinary symptoms among patients that receive a high dose of CYP for their therapy. Thank you for your interest and suggestions.